Okay. Hello, everybody. It's Dr. Alex Earl. We're here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. And today we're going to talk about BodyTite. So it's been a long time since I've talked about this. I've done it before in the past, and that's just a reminder. Like, if any of you guys want to go to some of the past Hump Days, get some real good education there, you should go to our YouTube channel. So go to YouTube to at Pure Plastic Surgery, and you can see all the old kind of Hump Days there. You can see multiple educational videos, pretty much discussing any plastic surgery topic that you can think of, plus all the questions and answers. So you can go there and see all the answers to all the questions that we get every single Wednesday here on Hump Day here at Pure. Okay, just a reminder, so today we're on Instagram, we're on TikTok, and we're on YouTube Shorts. Woo! All right, and here we go. So today we're going to talk about BodyTite, which is this machine here. I'm not sure if you can see that, but here's the machine. We typically have it in the operating room. It's pretty light. We can move it around from one OR to another. We have 3 ORs here at Pure. And the mother company is called InMode. So it's BodyTite by InMode. And what does BodyTite do? Well, BodyTite uses energy to allow for skin tightening or skin contraction. Okay, so that's the main purpose of the BodyTite, and it's very similar to another product you may have heard of, which is called J-Plasma. J-Plasma, which the mother company for that is Renuvion. Okay, so those are like the 2 big skin tightening kind of companies out there, the 2 big skin tightening products out there. So there's J-Plasma by Renuvion, and then there's BodyTite by InMode, and that's the one that we have here. All right, and so both of these machines, okay, what they do is that they use an energy called RF energy. So that stands for radio frequencies, okay? So that's the type of energy that they use. The way that they distribute the energy is a little bit different, but basically it boils down to that. So you have this RF energy, and then you're putting that underneath the skin. So this is different from what you may just get like in a clinic, and that's why we're doing it in the operating room, okay? So each of them is going to have a wand that's going to go underneath the skin to impart that energy to the fat and to the undersurface of the skin. And that's very important, okay? But the BodyTite actually does both. It imparts energy beneath the skin and on top of the skin at the same time, okay? And that's one of the things that I like about the BodyTite. So it imparts this radio frequency energy. What that energy does is essentially it melts fat and it heats the skin. When you heat the skin, you create this inflammatory response, and then that allows the skin to contract over the next several months, okay? So that's essentially how it works. And it can be done on any part of the body, okay? Now, is the effect immediate? You may see some immediate effects, but you're not going to see the full effect. It takes up to 6 months. So 6 months, okay, to see the full effect in terms of the contraction of the skin. All right? So it's going to be like a slow, gradual process there. You may see some effects immediately, but you're not going to see the full effects by any means, and you got to wait at least 6 months in order to do that, okay? Now it's typically very commonly combined with liposuction, okay? So a lot of times you do your liposuction first, you remove the bulk of the fat with the liposuction, and then you go and you follow that with your BodyTite, okay? That's definitely the way that you want to do it, especially if you're going to use that fat for fat transfer, because you can't use fat that's been hit by the BodyTite for fat transfer, okay? Just think of it as heat, right? It's essentially melting that fat. It's killing those fat cells. So once you use the BodyTite, that fat is no longer good for transfer. Those cells are not going to survive, okay? So when we're doing, for example, a BBL, and say for example we have BodyTite of the abdomen, well, we're going to do liposuction first, then those are the fat cells that we're going to keep and that we're going to use for the fat transfer, and then after that to follow, then we do the BodyTite for, to melt away a little bit more fat, and also for, of course, the skin tightening, which is the main purpose of the BodyTite. Okay. All right, so why do I like the BodyTite versus the J Plasma? Okay, so like I said, they use the same type of energy. It's for the same indications for skin tightening. But this machine has a few features that I like. One of them, of course, has to do with safety. And as you know, here at Pure Plastic Surgery, that's our #1 priority. We're always geared towards safety and doing everything that we can to make the procedure as safe as possible. And so what the BodyTite has is a feedback mechanism. It's kind of like a feedback loop mechanism. And what it does is that it tells me in real time exactly what the temperature is of the skin, just beneath the skin, the undersurface of the skin, and the temperature just above the skin, right on top of the surface of the skin. Okay, so I get two temperatures, what we call the external temperature and the internal temperature. Okay, with the BodyTite, you want that internal temperature to be about 68 degrees, and you want the external temperature to be no more than 38 degrees. Okay, and this is very, very important. Okay, now you may say, 68 degrees, that sounds like a lot, but when you're in, remember, when you're just underneath the skin, it's okay. Your body can tolerate that, okay? Now, it wouldn't tolerate that on the surface of the skin. That would cause a burn. That's why there's two different temperatures, and you have to know what each one is doing. It's very, very important, because if you go too high on the internal temperature, you can cause a burn from the inside, and that's typically a bad burn. That's typically like a 3rd degree burn. Okay, and if you go too high on the external temperature, you could potentially cause a burn on the outside. And that's usually not the 3rd degree, it's usually like a 1st or 2nd degree burn there. Okay, so with the BodyTite, I know exactly what my temperature is at all times. We know we're gonna be in that safe range, and we're not gonna be causing any potential damage to the tissues. And that's why I love that BodyTite machine. As soon as we start getting close to any of those ranges, it starts beeping at me, goes beep, 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 and I know I gotta stop and move on to the next area. But the opposite of that is also true. If you're doing BodyTite or J Plasma and you don't get to your target temperature, right? The temperature is much, much lower, then it's not gonna get you the skin contraction that you want. It's not gonna do the skin tightening that you need, right? So both things are bad, right? Too high temperature is bad because you can cause a burn. Too low a temperature is bad because you're not gonna get the effect that you want. So you have to be in a tight range. And I love that the BodyTite tells me exactly when I hit that range, when I get into that range, because then I know, A, I'm not gonna burn the patient, most important, and B, I have enough heat, enough energy there to get the reaction from the skin that I want, all right? And so it'll tell you the temperatures, and it'll also tell you the joules. Joules is basically how much energy you use during that session, okay? So those are the cool things about the BodyTite that I like. And another thing that I like about the BodyTite is that it has multiple different sizes. So the J Plasma at one point just had the one size. I think now they may have two. But the BodyTite has multiple different sizes, which I'm going to show you here. So the first one is what they actually call the BodyTite. So BodyTite is the name of the machine, and it's also the name of their largest probe, which is the one that we have here. So let me see, can you see that there on the screen? Pretty nice. So you see pretty big probe there. This is the part that goes inside. This is the part that's the outside, so it heats the skin from the inside and the outside. And you have a pretty long and large probe here. Excuse me. And so this is the one that we use for large areas. What are the large areas? The abdomen, the back, and the arms. Okay? So that's good for large areas there. Okay. So, but what if you want to do the chin? Well, that's way too big and way too powerful for the chin. Okay? So if you want to do the chin, then they have this other option, which we call the face tight. So you probably heard me talking about face tight chin. So let's take a look here. Can you all see that one there? As you can see, much smaller probe. Here's the big one. Here's the small one. Okay? So much smaller probe. It's thinner. It's not as long. And this is good for medium-sized areas. And the most common medium-sized area is the chin. And that's what we use that one for. Okay? So this is your medium probe. Okay? And then what if you want to get into a little tiny space, such as the lower eyelids? Oh, Well, now even the FaceTite is going to be too big for that and too powerful. The skin in the lower eyelids is super thin. It can be paper thin in some patients, okay? So you have to be really, really careful there. So for that, you have the BodyTite. All right, and that's the one that you see here. So now this is the FaceTite, this is the BodyTite, okay? So an even smaller probe, thinner probe, you know, very, very, you know, like small for the kind of sensitive areas such as the lower eyelids, okay? So this is for very small areas, and that's what, so we have all the choices there. We can do, you know, any area that, you know, the patient needs, okay? And then on top of that, it has the Morpheus, all right? So what is the Morpheus? The Morpheus is microneedling. It's like microneedling on steroids, okay? Because it's microneedling with RF energy. So some of you may have heard of microneedling or microneedling in PRP. Those are very, very common procedures that you do at med spas and clinics and stuff like that. But this is microneedling on steroids, okay? So we're not only injecting 24 needles in, but we're hitting, you know, we're injecting it, and then they're imparting that RF energy as it's inside the skin. And it can go fairly deep. It goes anywhere from 1 millimeter to 4 millimeters, okay? So 4 millimeters is very deep, and now there's a new one, there's a new Morpheus that can go all the way to 8 millimeters, okay? So 8 millimeters is very, very deep, and this is the piece there. If you guys can see that. So that's the piece for the Morpheus, and if you were able to look inside there's 24 needles in there that kind of, you know, hit you all at once and impart that energy. And so the Morpheus works really, really well for like the face, like just the face in general. So if you wanted to do like, you know, your cheeks and your lower and upper eyelids and your forehead and just wanted to do the face in general, you can do that with the Morpheus. And the nice thing about the Morpheus is that you can do it in the clinic setting. You don't have to have general anesthesia or MAC anesthesia. All you have to do is come in about 30 minutes before your procedure. We put a numbing cream all over your face or whatever area that we're going to use the Morpheus. In about 30 minutes, that skin goes very, very numb. And then we just go ahead and start hitting you with the Morpheus, and that takes maybe about 10, 15 minutes max. And then boom, you're on your way. It's kind of one of these lunch procedures where you can do that, go back to work, go back to the office, and you know, there's minimal downside, no pain, typically no bruising or anything like that. Okay. All right. So those are all the reasons why I like this machine. It works really, really well. If y'all go to our Instagram, you'll see some results there. There's actually a very recent result about with a BodyTite to the arms that did fantastic. So you guys should go and check that out. Okay, but that's pretty much it. So I'm happy to answer any questions as it relates to the BodyTite, or actually, you know, any other kind of plastic surgery question that may come up.
Okay, let's go with the questions. Yeah.
Let's do some questions.
What makes you the safest BBL doctor?
All right, so I think we are extremely safe. I would definitely say one of the safest, if not the safest out there. And the main thing is, there's two main things. One is experience, and two is the use of ultrasound guided imaging technology, okay? So it's not my first rodeo. I've been doing BBLs for a long, long time, and I've done probably about 3,000 BBLs. So I have about 3,000 BBLs under my belt. Which means I have a lot of experience with this procedure. I know exactly where I'm at all times, and I know, you know, not to overdo it, right? You don't want to. Every time you try to overdo things, that's when you run into problems. You run into complications. Okay. The other thing is that I've been using the ultrasound since 2019, and I've probably done the most ultrasound guided BBLs of anyone in the nation. At almost, you know, just under 2,000. We've done about maybe 1,800 or so ultrasound guided BBLs. And what the ultrasound does is that it helps me, you know, basically turns a blind procedure from one where I can see, and I know that I'm putting that fat in that safe space, which is between the muscle and the skin, where there's no chance of getting a fat embolus, which is the primary cause for death after a BBL.
Okay, Doc. This patient says, I have thalassemia, but my hemoglobin is at 12. Can I still have surgery with you?
Yeah, if your hemoglobin's at 12, then that's okay. So I think we talked about it a little bit a couple hump days ago, but the issue with thalassemia is that some people that have a bit more severe thalassemia, they can't get their hemoglobin levels up, and they're constantly under 11, even if they take iron or iron infusions and stuff like that. So in those particular patients, we can't move forward. But if you have a milder case, like it sounds like yours is, and your hemoglobin level is 12, then yeah, we're good to go.
Are there any contraindications hormonal-wise for BBL surgery? PCOS, endometriosis, etc.?
Yeah, so not particularly. So we do a lot of patients with PCOS, that's polycystic ovarian syndrome, and that's typically not a problem. If you have a thyroid disorder, that's usually okay, as long as everything is controlled, right? So that's the key there. So you have to be on your medications, your levels have to be controlled, but if all that is okay, then we're able to move forward. And the other thing that we're going to need, though, is a clearance letter from your primary care provider.
Okay, Doc. I have a 20 BMI. Will that be okay?
For what procedure? For most, really honestly, for most procedures, it's definitely okay. It's a little bit on the lower side for BBL, but it's still within the range. So my range for BBL is between 20 and 30. So you're at the low end of that range. It all depends on really what you're looking for. So if you're looking for huge change and big booty, of course we may not have enough fat to do that, and you may need more than one round. But if you're looking for, say, like the SO BBL with beautiful enhanced natural results, nice smooth transitions, then typically a BMI of 20 is perfect for the South Beach butt lift or skinny BBL.
Can someone with a diabetes type 2 get a tummy tuck?
So the answer is yes, but you have to make sure that your diabetes is well controlled. You have to be on all your medications, and we're going to be checking a laboratory test called the hemoglobin A1C. Okay, so if that hemoglobin A1C is 6.5 or less, then we are good to go. That means that you have a good control of your blood sugar levels. Okay. Now, if it's above that, then we're going to have to work with your endocrinologist or your PCP to try to get it to that more controlled level before we go into surgery.
Doc, this is an out-of-state patient, and she asks how long should she stay in Miami?
Great question. So we get a lot of patients from out of state. I would say probably 80+% of our patients are from out of state, and so the minimum stay is 5 days post-op. That's really the key there. So you can't leave before post-op day 5, all right? So what does the total stay end up being? For most patients, it's about a week, because you come the day before surgery, that's pre-op day. And then, of course, you have surgery day, and then you have to stay 5 days after, so that's 7 days. That's for most patients, okay? Now, if you can stay longer, great, but certainly no less than that. And in fact, if anyone leaves before post-op day 5, then they're leaving what we call AMA, against medical advice. Okay, so make sure you plan that ahead of time. Make sure that you're able to stay here at least 5 days before heading back home.
Doc, this is a common question. How long do you have to wait to have sex after a BBL?
Great, so that's a very good question, and it's easier to ask it in this way, because a lot of patients, once they come into the clinic, sometimes they get a little bit embarrassed, and there's nothing to be embarrassed about. It's a very important question, and I just wrote about that recently in our Facebook group, actually. But the answer is you're going to want to wait at about 6 weeks, okay? 6 weeks. So there really shouldn't be any strenuous activity or heavy lifting for 6 weeks, and sex kind of falls into that category, and so no sex for the first 6 weeks post-op.
Okay, how I know if I have to lose weight for a BBL?
All right, so there's a few ways to tell, but the first thing, the easiest would probably be your BMI, okay? So you can go to Google, and you can Google search BMI Calculator, okay? So you got your BMI Calculator, and that's gonna tell you to input your height and your weight, okay? So you put in your height, you put in your weight. You click on it and it's going to give you your BMI. And we want your BMI to be less than or equal to 30. Okay? So if your BMI is higher than that, then you're going to have to lose some weight. So that's number one. Number two, it also depends on what your goals are. For example, say your BMI is 30, which is fine, we can do surgery, but you have a goal that you want to be 20 pounds less than that, right? Well, it's much, much better to do your surgery once you're at your goal weight than to do your surgery and then lose 20 pounds. Because if you do it that way, then your body's going to change, right? Skin that might have been tight will become loose. So say, for example, you're doing a tummy tuck and then you lose 20 to 30 pounds, that skin may become loose, okay? Or if you're doing, for example, a BBL, you have those nice round hips and all the volume that you wanted, and then you lose 30 pounds, well, that fat's going to react with the rest of your body. You're going to lose volume in the buttock and hips as well, okay? So the two key things are to be in the BMI range that we like, so less than 30, and try to be at your ideal or goal weight.
Do you recommend to do a quote for cellulite before the BBL?
Yeah, so it can be done, it can actually be done before or after. Either way is fine. It just can't be done at the same time. So when you use Quo is an injectable that we have that we use to basically break up the bands of cellulite. And it's an injectable that can be done in the clinic, doesn't require any anesthesia, but it does require 3 sessions. So there's a little bit of a commitment there. So you have your first session, 3 weeks, second session, 3 weeks, third session, and then you're done. Now, what happens with Quo is that it has an enzyme that breaks up these attachments, and a lot of times there can be a lot of bruising, and this enzyme is not too friendly to fat, which is the main reason why you cannot do it at the time of fat transfer. If you do it at the time of fat transfer, the enzymes are going to not allow that newly transferred fat to live, and so it's just not a good scenario. All right, so you got to do it either before your BBL or after your BBL, and you probably want to wait about at least 3 months, in between the two.
Do you recommend a BBL pillow to fly home, or how can patients fly home? Can you recommend?
Yeah, so you're definitely going to need that BBL pillow to fly home, okay? Because there's all sorts of things that are not predictable that could happen in the flight, right? There could be turbulence. You're definitely going to need to sit for takeoff and landing. There can be an unfriendly flight attendant, all sorts of things, okay? So definitely make sure you have your BBL pillow, because you're going to have to sit at some point, and it's best if you're sitting in your BBL pillow and not putting any pressure on the buttock and hip area during the flight. Now, if you have, if you're lucky and there's not a lot of people on the flight, sometimes you can get a few seats and kind of lay down on your belly, or if you don't have anyone kind of behind you, you can kneel for part of the flight. And of course, you should always think about getting up at least every hour to hour and a half to walk up and down the aisle to keep the circulation in the legs moving.
How can I gain weight for a BBL?
So if you're say your BMI is 19, which is going to be too low typically for a BBL, even a skinny BBL, we are going to ask you to gain weight, and of course, what you need to do is increase your calorie count, right? So if you can do that through kind of just your regular diet, that's great. But a lot of times you will need help, and so then I do recommend taking additional calories through supplements such as Boost. Which is one that you can get, in most supermarkets. You can find the Boost, which is going to help, or Ensure as well. That's the other one. So Boost or Ensure is going to help, pack in the calories and pack on a few pounds.
Okay, this patient wants to know when she should stop smoking marijuana before the surgery.
So the key to marijuana is that it cannot be laced with nicotine, right? So a lot of times, either the marijuana itself or some of the papers and things that you use to roll the marijuana have nicotine, and that's going to be a problem, okay? Because the main issue is the nicotine. So if you have anything with nicotine, you got to stop that 30 days before surgery, all right? There should be no nicotine in your system when you come in for surgery. So there's no nicotine 30 days before to 30 days after surgery. Now, if you're having THC and it's kind of pure, no nicotine, then actually that's okay. You only need to stop, a couple days before surgery, and to about a week after surgery, after you're done with all your medications.
Okay, I have scar tissue from pregnancy and tummy tuck. Do you recommend lipo?
So that I'm gonna have to take that on a case-by-case basis. So what I would recommend is to go to our website. So go to pureplasticsurgery.com. There you're gonna see a button that says virtual consultation. That's the easiest and fastest way to get to us. You're gonna hit the virtual consultation. You're gonna fill out all the information on the questionnaire, and importantly, you're gonna send your photos. Okay, and then I'll be able to take a look at everything, look at your history, see what surgeries have been done. And I'll be able to evaluate all your photos. We're gonna need at least 3 photos, a front view and 2 side views. And if you're doing a BBL, 4 photos, front view, side views, 2 side views, and the back view. And based on that, then we can make a determination as to whether we can help you with liposuction, after your tummy tuck or pregnancy and scar tissue and whatnot.
Okay, is it safer awake versus sedated?
Yeah, I don't think so. Of course, as long as you go to the right people, right? But there's actually potential dangers with each, and I don't like doing awake liposuction. I think for a few reasons. Okay, number one, in order to do that, you have to use a medication called lidocaine, right? A numbing medicine. Lidocaine is similar to the Novocaine that the dentists use when you get numbed up when you go to the dentist. Very, very similar. And we have to put that inside the tumescent fluid, which is the fluid that then we instill throughout the tissues before we do the liposuction. Now the issue is that there is such a thing as lidocaine toxicity. If you put in too much lidocaine, that can lead to very serious problems, neurological problems, and cardiac issues, and even cardiac arrest. Heart stop. Okay, very, very dangerous if you get into that range. So what happens then is sometimes, say if you're doing the procedure and the patient's still feeling pain, maybe you can put in a little bit more, but you're going to get to a point where you just cannot put any more because it's dangerous for the patient, and then they're just going to be very, very uncomfortable throughout the procedure, and then you're not going to be able to get the results that you want because the patient is uncomfortable and you can't be as aggressive as you want. Okay. So for all those reasons, for me, I recommend using general anesthesia, and that's what we use for all of our procedures, including all of our liposuction and BBL procedures. That way, I don't use any lidocaine, 0 lidocaine. So the chances of having lidocaine toxicity with me here at Pure, because we use the general anesthesia, is 0, because we don't use it at all. Okay? So you're comfortable during the surgery, you're asleep, you're not gonna wake up. All right, also with general anesthesia, when they're putting the tube and we're breathing for you, there's 0 chance of waking up in the middle of the surgery. Okay, so you're not gonna wake up, you're not gonna have the lidocaine, you're gonna be comfortable doing the procedure. I can do whatever I need to do to bring out the best result. Okay, and then we'll wake you up, and then you'll be in recovery for a while and you'll be doing great. Okay, but you have to have good and safe anesthesia providers. All right, and that's what we have here at Pure.
Can I get a round 2 BBL if I had some fat necrosis?
So, I mean, the short answer is yes, but once again, that's something that we're going to want to take on a case-by-case basis. It depends on the extent of the fat necrosis, right? So, if it's kind of mild to moderate, for the most part, yes. And what I try to do is that I try to break up the areas of the fat necrosis at the time and kind of inject fat around the area to soften that whole spot up. Now, we have a very large area of fat necrosis. Then in that particular case, I may decide not to do it. It's just not worth, the additional, procedure. Okay. All right. Okay, everybody. Well, I hope you enjoyed that. So we talked about BodyTite. We went over everything that this machine can do. I highly, highly recommend it for any patients that need skin tightening. So it's a great, great tool to tighten the skin in the chin and the arms. I think it works really, really well for that. And the belly is, for those patients that are, they're not quite to the point that they need a tummy tuck, but they still have some skin laxity. And it's best then to help tighten that skin so that it doesn't remain loose after your liposuction procedure. Okay, so those are the most common indications there. And another great place to use it is the thigh, because thigh lifts are just, they're very difficult surgeries in terms of recovery. And so rather than doing a thigh lift, the BodyTite works very, very well for the inner thigh area. Okay? All right, but I look forward to seeing everyone next week. We'll come up with some other plastic surgery topics. Make sure to look at all our old Hump days on YouTube. All right, but I'll catch everyone next week on Hump Day with Dr. Alex Earl. Ciao.
Okay.